Assalamualaikum warahmatullahi wabarakatuh and good morning. My name is Mastura binti Muhammadan. I am currently attached to the Ministry of Defence Malaysia since August 2020. My research title as a master's candidate for the Masters of Innovation and Technology Management was Issues and Challenges in Health Risk Management of Communicable Diseases Amongst Foreign Workers in Malaysia. Now, did you know? According to the World Health Organization, or WHO, tuberculosis is listed as one of the mortality and burden of diseases present in Malaysia. WHO reported there were more than 25,000 notified cases in the country in 2018. The national TB budget is domestically funded, and in 2018 alone, the amount spent for control and treatment was $16 million. Do take note, the 2 million foreign workers in Malaysia are legal or documented workers that are in the system. Their data are available and they have been certified fit to work by FOMEMA. In reality, however, there are unknown numbers of foreign workers as they are undocumented or, in other words, working in the country illegally. According to Sandragani, foreign workers are at a higher risk of contracting and transmitting communicable diseases, while Moran states that foreign workers with communicable diseases poses a challenge to the host country's public health. Both Sandragani and Morans agree that it is important for host countries to properly manage risks of imported communicable diseases through detection and control. There are, however, relatively few investigations conducted in Malaysia to explore the issues and challenges in managing health risks due to failed medical screening for migrant workers. In order to guide this study, two research objectives were defined, which are to explore and understand the issues and challenges in managing foreign workers that fail medical screening for VPTE applicants, and to enhance the current guideline in an effort to reduce health risk of communicable disease from the perspective of public health management. In order to achieve the research objectives mentioned earlier, three main research questions were designed. The research questions for this study are: what are the issues and challenges in terms of health risk management? What are the challenges linked with the repatriation of migrant workers? To what extent is the system effective in managing foreign workers? Based on literature review done, Rasson's adaptation of risk management framework was adopted for this study. Risk management is a continuous management process with the objective of revealing potential hazards, identify and reduce risk control measures to eliminate or reduce harm. Elements of risk management comprises of risk analysis, risk evaluation, and risk control. An emphasis on risk analysis was made in the study. This is the overall process of foreign workers management which was obtained from the Ministry of Home Affairs Malaysia. It starts from employers applying for quota to hire foreign workers all the way until the workers return to their country at the end of their employment tenure. This is a simplified process flow for a worker to obtain their VPTE or work permit. It starts with the security clearance in their home country until the issuance of a VPTE and I-card in Malaysia. Do note, there is a time gap of 4 months between the biomedical screening at source country and at the first medical screening in Malaysia. By right, no discrepancies should occur. However, in that time frame, foreign workers are exposed to possible transmission of disease or for a person to get infected with TB as TB is an airborne disease. The study uses a qualitative approach, adopting a case study method. Technique of data collection were through semi-structured interviews and document analysis. Analysis of data obtained were through thematic analysis and document analysis. Data collection involved two phases. Upon receiving ethics approval from Medical Research Ethics Committee, documents were obtained from governing bodies. After reviewing the documents obtained, semi-structured interviews were conducted with the relevant bodies involved in foreign workers management. Respondents' inclusions are government officials and implementers with at least 10 years working experience with the management of communicable diseases and foreign workers as well as the issuance of VPTE. The findings from this study will be presented according to the research questions mentioned earlier. For research question 1A, the attempt was to understand how far of a threat to the public in terms of health and health management does communicable disease presence among foreign workers have. In simpler terms, it is trying to figure out how much of a threat would foreign workers with communicable disease have towards the public. The terrometer was initially used to estimate the possibility of a terrorism attack after September 11th. Based on interviews conducted, it can be concluded currently the level is guarded, or in other words, moderate. However, there are reasons for concerns, for without proper management, the risk will increase. The cause for concern is not the documented workers, but rather illegal workers or UNHCR card holders. For documented foreign workers, they have been certified fit based on their FORMEMA medical screening. As for UNHCR card holder and illegals, they are either not being screened or they are runaways that have failed their medical screening. They work, live and socialize with the general public in their day-to-day lives. The most worrisome part are those that have latent TB, as they are most of the time asymptomatic or they do not show any signs of having TB. And yet, TB is an airborne disease where anybody within a patient's vicinity have a chance of contracting it. Research question 1B looks at the precautionary measures to reduce possibility of transmission. Just like COVID-19, to break the chain is to eliminate as soon as possible those that have been affected. For the case of communicable diseases among foreign workers, it was suggested to minimize contact with the public prior to FORMEMA medical screening. Currently, the policy with regards to TB is screening only, which is done through chest x-ray. It does not involve confirmatory tests. Therefore, it is proposed that chest x-rays are done immediately within 48 hours of arrival and to eliminate the possibility of socialization and transmission. Foreign workers should be quarantined immediately upon arrival. Therefore, it is proposed that chest x-rays are done immediately within 48 hours of arrival and to eliminate the possibility of socialization and transmission, foreign workers should be quarantined immediately upon arrival. This will actually solve two challenges faced currently. First is the possible spreading of diseases that are airborne, and secondly, it will reduce the possibility of workers to run away when they are diagnosed to be unfit to work in Malaysia by FORMEMA. Research question 2 attempts at understanding the challenges to deport foreign workers that were found to be unfit due to medical conditions by FORMEMA. Based on interviews conducted, employees are to be sent back due to failure of FORMEMA medical screening and the non-issuance of VPTE to work in Malaysia. Due to the circumstances, these workers have put themselves to work in Malaysia, going back to their home country within a month of arrival is not an option for them. If there are no demand for foreign workers regardless of their documentation status, workers will not run away from their employers. Because there is a means for survival is what causes them to be bold and run away. Ladies and gentlemen, unlike documented foreign workers where the employers are responsible to provide accommodation for their workers, undocumented foreign workers do not have that luxury. Therefore, they will have to seek accommodation on their own. A responsible landlord would rent out their premises to use as accommodation or business premises to undocumented foreign workers. Research question 3 is with regards on the effectiveness of the system being used by governing bodies to manage foreign workers. Based on interviews, the current system, which is MyIMS, is fairly effective. However, active actions are needed to improve the agency system for societal well-being. As I have showed earlier in this presentation, there are a number of patch-on systems. Two other systems are being used for medical screening of foreign workers. FWCMS for the biomedical at home country, FORMEMA used in Malaysia. Both these systems are linked to MyIMS where the rest of management of foreign workers takes place. Biomedical medical screening means biometrics, all 10 fingerprints of the foreign workers are being scanned, and their medical results will be transmitted online. For FORMEMA medical screening, once employers have registered their workers in MyIMS upon arrival, it will be linked to their biometrics information which has been captured. FORMEMA medical screening will be transmitted online as well. However, FORMEMA system allows for the change of medical screening results. Unfortunately, MyIMS more or less does not allow for VPTE revokement. There is no notification or alert in the system of any medical changes made for immigration officers to take the necessary actions. Even if there was, VPTE and iCard are being issued physically. These are the themes and sub-themes that I have found to emerge during analysis of the interview transcriptions. There were 3 main themes and a total of 10 sub-themes. To improve on foreign workers management, 2 main actions are recommended. First is for stringent actions towards employers employing and landlords renting premises to undocumented workers. And second is for the government to update on technology for the use of immigration officers, especially for monitoring and control purposes. This includes development of a new system, as the current system is already beyond optimization. And in line with that, the system should be able to revoke VPTE issued. In doing so, it is recommended the current iCard is to be replaced with a card that is equipped with a smart chip. Therefore, Immigration Department will require portable devices to read the iCards when they are doing monitoring or when they are conducting operations on the ground. Just like what is currently being enforced to identify those that are COVID-19 positive, it is also recommended for foreign workers that arrive to undergo a compulsory medical screening immediately upon arrival, as well as having the medical checkup. Perhaps to give some time for employers, only chest x-rays to screen for TB should be done immediately, while the rest of the medical checkups and tests can be conducted as they are being done currently, but within a lesser time, perhaps 14 days as being done by our neighbouring country, Singapore. It is also suggested for medical screening to be infused with micro-credentials. For foreign workers management, we take it a step further where the medical centres can be monitored. To tie all this, policies with regards to employment tenures, requirements imposed on employers, medical screening, among others, needs to be analysed and revised where necessary. As for finance, medical screening of foreign workers costs 190 ringgit for female and 180 ringgit for males. It is recommended that tuberculin skin tests are done and BCG are administered prior to travel to Malaysia. This is to reduce the possibilities of the workers to contract TB. Now, it is foreseen that there will be some resistance to adopt this as there will be additional costs to employers. However, employers will have to oblige if they are to hire foreign workers. Hiring foreign workers is not a right. It is merely a benefit that the government has given to employers when quotas to employ foreign workers are approved. Employers should reduce their reliance on foreign workers. This is to ensure stability of the economy as well as work opportunities for locals. Hiring foreign workers is not necessarily cheap, but it is convenient for employers. Respondents state that foreign workers cannot go anywhere or change employments, or they will risk of being illegals here. So, employers more often than not offer minimum wage regardless of the work involved, and of course, when better opportunities emerge, locals will go for that. Locals are willing to work as long as their welfare are being taken care of. For other sectors, automation within the processing line should be implemented. These are just two examples where reliance on foreign workers can be reduced. The third issue are human rights issues, with living condition being the main issue. Employers are required to provide accommodation for workers. More often than not, what happens is it is less than desirable. Foreign workers do not have the avenue to fight for their rights, or they are simply afraid. Therefore, it is recommended private agencies to house accommodation complexes which can be rented out to employers for their foreign workers. This is to address the substandard accommodations currently being provided for them. And of course, these accommodations should be monitored by the government to ensure the safety aspect as well as the cleanliness and well-being of the workers. With that, this is the proposed revised guideline for VPTE issuance. Most of the items here have been presented just now. The blue boxes are where new steps are proposed, while the yellow boxes with red fonts are where the improvements or enhancement towards the existing actions are being proposed. As far as the contributions of this research is concerned, there are two areas. First is in theory and knowledge. This research has presented the link between risk management and foreign workers management. Secondly, in practice, a revised framework for medical screening is proposed for policymakers and implementers' consideration. For future research, I would like to propose a policy analysis to be done with regards to the medical needs of foreign workers. The current policies that are in force could be reviewed, and recommendations are to be proposed based on the policy analysis conducted. Medical-related issues could also be explored in order to improve the health and livelihood of workers that are abroad for work. Other possible future research considerations could be to compare and contrast health programs between countries and the disease prevalence as a result of those programs. In conclusion, the government and employers are responsible and have their own parts to play in order to reduce dependency on foreign workers in the low and unskilled work sectors. For those foreign workers that are here, enhancements are necessary in their management to ensure their well-being are taken care of and their human rights are met. I have proposed a revised framework for medical screening and VPTE issuance as management of foreign workers that have failed their medical screening. With that, I conclude my presentation and thank you for your attention.